everyone. Welcome to Phenomenally TV. And today I'll be talking about endometriosis and its new drug, Orilissa. This is something that I am on. This is something that I suffer with. I just want to give a quick review on things on this journey that I'm taking with this. Okay? So endometriosis is a disease basically that happens only in women. And it is when your endometrial lining grows outside of your uterus. Once it grows outside of your uterus, it spreads to other organs like your fallopian tubes or your ovaries, basically, and it can cause many symptoms. Some of the symptoms that it can cause is pelvic pain, painful urination, a decrease in your immune system, sore lower back and shoulders, intestinal pain, mood swings, blood clotting, bowel changes, bloating, and infertility. Now, things that I suffer from endometriosis is severe pain. Like I have really bad periods every month, and it is bad. Like I get nauseous. Sometimes I can throw up, and the pain can last anywhere between an hour or two. I do take drugs for it, like Motrin and Advil. Aleve doesn't work for me, but that is something that is given to people or recommended for people with menstrual cramps, but they don't really work. It can also cause a vaginal bleeding, which is something that, again, I suffer from. My bleeding can go anywhere from, say, 2 weeks, a month, 2 months. I think the longest period I've had is like 3 months. But I wouldn't say that's all because of my endo. It was really a combination of my endo and fibroids, which I'll talk about in another video. Okay? Endometriosis is extremely hard to diagnose because it can't be diagnosed through urine or a simple blood test. The only way you can 100% diagnose endometriosis is if you do exploratory surgery, where they go in and they basically look if your endometrial lining is growing outside of your uterus. Okay? Once they do that, most of the time they'll do surgery, which is the best option to treat and, I guess, cure endometriosis. And I say cure because it can come back, basically. So basically, you would be in remission. I haven't had the surgery yet. It's something that is on my list to do eventually in the next couple of weeks. I am graduating college soon, so just want to get that out of the way and then straight to the operating table. Again, like I said, there's really no way to diagnose it. What doctors do to diagnose it is basically you go to your doctor, you tell your doctor the symptoms, and they will diagnose you from there. They will give you hormonal treatment, which doesn't necessarily cure the disease. It only suppresses the symptoms. So as I said before, surgery is really the only way of really taking care of it and getting rid of it. And of course, it's something that you want to do sooner than later because, as I said before, it spreads to other organs, which can cause infertility in the long run. And depending on the stages of endometriosis that you might have, it might be already there. There are 4 stages. Most people have stages 1 and 2. Stages 1 and 2 they're basically named the minimal, mild, moderate, and severe. I don't know what stage I have. I haven't been told what stage I have. I don't think I have stage 4 only because they have checked my ovaries by looking at a ultrasound. I had a vaginal ultrasound as well as a stomach ultrasound, and most of the time they'll do that for you to look if anything's going on. But again, as I told you, I have other issues such as fibroids which comes into play with all of this, with all these. Another thing that I suffer from is blood clots. I do have a lot of blood clots and heavy bleeding. actually a lot of heavy bleeding. Um, Again, it can be in combination of both of my fibroids and the endo, but I do get a lot of clots. Sometimes my clots can be as big as my hand or even bigger, right? Bloating and bloating again, something that happens with every menstrual period, but at this point it would be excessive. I don't really suffer from that much. I don't have heavy bloating. It doesn't happen every month. Mood swings. I've never really suffered from mood swings up until a few months ago. But with in the process of trying to suppress my symptoms and being on different birth controls, I I did have fibroid surgery last year in July, and I put an IUD in, and I think that made my mood swings go. I did have a lot of mood swings, but as of right now, I don't have much. Um, you have bowel changes. I don't see too much of bowel changes in myself, but I have always noticed that when I've had my period, that I do have maybe like diarrhea or or loose stool, TMI. But yeah, I do notice that, and also since the point of which I've got my period, which was at the age of 9, I've always had severe cramps. If you have severe cramps, you're gonna want to talk to your doctor about it. Even if you don't have severe cramps, even if it's something that you know you can really fight through it, still talk to your doctor about it, because honestly, and a lot of women think this is normal because so much of us suffer from menstrual cramps, but you're honestly not supposed to feel any sort of cramps at all during your menstrual cycle. It is common, but it's not something that's supposed to happen. So still talk to your doctor regardless. Of course, it probably will be nothing, so don't freak out. But still talk to your doctor about this. This is one of the things that I kind of regret growing up, not speaking about my pain or researching, the possibilities of my pain a lot sooner than later, because of the things that I'm going through now. So I just want to say this to like educate other women out there, other girls, because as I said, I've had my period since I was 9, and I've been feeling severe pain from that point. So I've probably always suffered with this, but again, because I spoke to my doctor late about it because I thought it was normal. I just suffered with the pain for all these years. Okay. Now, I'm currently on this new drug called Orilissa. Orilissa is a new FDA approved drug that is approved for endo. The medical term is called Elcolax. And basically, it is, I'll show it to you. It is in if you can see, packaging like this, and it is set up similar to a birth control. You get 7 pills in each box, and you get 28 total. Basically, this is supposed to help your pain symptoms. It doesn't work right away. It can take up to 2 months to work. So I haven't really seen any improvements, or because I did have my period recently, and I was in severe pain, crippling pain, crying, and no matter what I did, and it was for a couple of days, and no matter what I did, took medication, used a hot water heating pad or a hot water bag, whatever you choose to use, it just the pain wouldn't go away. As I said, my pain usually lasts from like 1 to 2 hours. So honestly, I don't believe the pills work. Maybe they do, maybe they're not. But I just think that up until that point, the pain breaks and then it's gone. Orilissa was not the first drug they prescribed to me for my endo. I did other hormonal treatments, such as being on birth control, the pill. I also was on NuvaRing, and I was also on the IUD. I'll speak about those birth controls and why they worked or why they didn't work in my next video. Also, when you're on Orilissa, you can't be on any birth control pill, or most birth control pills. Basically, you can't be on any birth control pills that has estrogen in it. Anything that has estrogen in it will make the drug Orilissa less effective. Okay, so your best bet is to either be on an IUD, or a progesterone only pill, which is what I'm on right now. I was on the IUD. I had to come off for other reasons. So right now I'm on a progesterone only pill until I can get back on the IUD, which I much prefer. Um, Here is my progesterone only pill. This one, it is called, hopefully I don't butcher the name too much, it's called norethindrone. This is a progesterone only pill, and progesterone only pills are even stricter in the time, so you have to be very, very strategic of when you take them. So you need to take them the same time in the morning, same time in the afternoon, same time in the night, whichever time you choose. What I do is that I put a time, I put it in my calendar and just let it beep off. It goes off on my watch, goes off on my phone, and as soon as it goes off, I don't say, well, I'll take it 5 minutes from now, or I'll take it when I'm finished. I drop anything that I'm doing and I use it only because I really need this to control my bleeding as well. Again, Orilissa is not a birth control pill, but it is set up like a birth control pill. And although they don't specify, or my doctors haven't said, well, you have to take it at a certain time every day, I still do it at the same time. So what I do is I take my Orilissa and my birth control at the same time to help to so I don't forget. And so, because it is set up just like a birth control pill, as I showed you earlier, it has the days on it. I don't know if you can see, like it has Sunday through Saturday on there. Okay. As I said, this is my second week being on Orilissa. It hasn't helped my pain just yet. I haven't seen any improvements, but as I said earlier, it takes up to 2 months. Symptoms, side effects that you can get from this is bone loss and hot flashes, nausea, depression, suicidal thoughts. Things that you should take to combat those are vitamin D and calcium. I also am going to set up an appointment to speak with a counselor like once a week, just to make sure that my mental state is off. I don't feel like it's off. I do have days where I'm sad, but not depressed or having suicidal thoughts. Again, I'm not a doctor. I'm just telling you the things that I know, things that I've researched, things that my doctors have told me, and just basically my experience so far. I will give you updates. I will try to give you weekly updates. I know I didn't start on my first week, but there hasn't been any big changes, so I don't think it would matter. As I said, the only thing right now that I hate about the pill is that taking these suckers out is so hard. You have to be like the Hulk to push them through the back. But other than that, there's really no side effects or anything that I'm noticing. I might have a little bit of hot flashes. I did have nausea on my last period when I was cramping, and I did throw up, but that's happened with me off the pill as well. So I wouldn't even say that was a side effect from the pill. Whenever my pain gets really bad, I either just black out, pass out, or I'll throw up when the pain gets so severe that my body just can't handle anymore. But if you have any questions, you can ask in the comments below. I'll try to answer in a video, or I'll respond. And welcome to Phenomenal We TV. Like, subscribe. Bye.